This tiny landlocked mountain kingdom of Lesotho is fighting its own silent war. A third of its 1.8 million citizens are infected with HIV, and over 90% of those people are also living with tuberculosis.
There are people who are affected with HIV, and there are people who are infected with HIV, and there are many. Here in Lesotho, if you are not infected, you are affected. Every family here in Lesotho is dealing with HIV and AIDS.
Lesotho has the third highest HIV rate in the world. So for example, some of our patients who are here today are from a village that 70 people live in. 47 of them are our patients.
Life expectancy is down to just 34 years. Over 80% of Lesotho's population lives in the mountains, where there are no roads and very few tracks. The average walk to the nearest clinic is 4 hours over rocky paths. For those who are ill, this is a slow and painful journey.
If a patient is very sick, they will often be brought into clinic either carried on a stretcher by several people from the village who are hired. Sometimes they're carried in on the backs of another adult in a piggyback style. We've had patients dragged in wheelbarrows. We've had patients who sometimes come on horseback.
People present at hospital, it's often too late because they're so ill, they've come when they're so ill that everybody's motivated to get them there over a large distance, find the bus fare, whatever it is it takes to get them there, and by that time it's the disease, it's an advanced stage.
And that literally means hundreds of patients aren't getting care and they die.
How are you? Good to see you.
The Elton John AIDS Foundation, Riders for Health and the Ministry for Health are working together on an innovative new motorbike service which will revolutionise the way that medical care will be taken to the people.
How long did it take you to get to the patient?
To the place?
To get to the patient?
It took me about 4 hours.
4 hours?
Yeah.
Riders for Health train the health workers how to ride, service and maintain the bikes. This means they're able to see and care for 5 times as many patients in the same period of time, saving thousands of lives.
The fantastic thing about the Riders program is it's giving doctors, nurses, clinics access to patients that they never normally see because they're up in the mountains and they never get to a health post.
We often have to walk or take horses, which will turn what could potentially be a 2-hour trip in which you see 4 or 5 villages becomes an 8-hour trip in which only 1 village can be seen.
Each motorcycle will reach 20,000 people approximately, but we're running at the moment somewhere in the region in Africa of 1,000 motorcycles, and we're reaching about 10 million people.
I am very honoured to be in Lesotho. This is a beautiful country and this is an incredible campaign. People all over the world who are sick with HIV and AIDS need love, care and support, medicines and people to nurse them when they are sick. These motorbikes are going to make such an incredible difference because this is an incredibly difficult terrain, and at the ball that we have in England we ask people to put their hands up and buy a motorbike for the people of Lesotho, and a lot of people did, and as a result I'm standing here today with a lot of people from England who are here to witness the launch of this campaign. And today is a magnificent example of what can be done to get these people the help that they need.
Lena, kita bate.
The 120 bikes, bought and maintained through the Elton John AIDS Foundation's funding, will expand the number of patients served in communities from approximately 480,000 to 2.4 million.